Joining us in studio, Dr. N. Prathap Kumar, MD and Chairman of the Mediterranean Group of Hospitals from Kollam in Kerala. Dr. Kumar, the government, when it says that we should now go in for public-private partnerships, is that an easy way out?
100%, that is the point. Actually, India has a communicable problem and non-communicable diseases. The communicable diseases actually happening even in Kerala. I am from a most literate place of the country, Kerala. We have 96 cath labs for a 32 million people, which is more than the US average. That is more than 3 lakhs of population. We have a cath lab which is available in the US for 5 lakhs of population. You go to Bihar and UP, except Patna, nothing is there. If you go to UP, again Lucknow is the only confined place. All these young energetic doctors, after passing out of their MBBS, they will never ever ready to work in a rural area. That's the most important challenge of the country. Whatever money spent by the government, I think if you are ready, you can do that. For that, there are some prospective things to be done. All the people who are becoming specialists, they will tell that their children should be in one of the biggest school available in the country, one of the biggest atmosphere they should grow. Then how we can talk about the poor people of the country, which are actually residing in the rural areas, which is 80% of the population, never get real treatment in the country, because 80% of the treatment is happening in the 20% people surviving metros. So that is why I tell, there was the first PPP model cardiac setup was started by me in ESI hospital in the country. It is in Koilon. We have done 2,800 angioplasty in the last 4 years, saved how many lives? That is one point. In Haryana, there is no cath lab in the government setup in Haryana government. Everything is in the private sector. I represent the private hospital, but we are going to do 50% of the cost of the central government health scheme cost for the poor patients, which will be reimbursed by the government. That is the only way. I will tell you the solution for these things, that tier 1 cities, doctors should be paid less. Tier 2 and tier 3 cities should be paid double or 4 times the pay. Then all these doctors will go to the tier 2 and 3.
But I think they have put in systems to put in incentives like that, but it still hasn't been working.
It is not an incentive. I am not telling it is incentive. It is incentive to the public. 80% of the people stay in tier 2 and tier 3 cities. You are actually looking after this. Basically, I think education in our country has a problem. They are actually trained in some small buildings. They never see a patient. And they actually, after training of nursing for 4 years, they come out, they go to a hospital, they work for 6 months, and then I'm a trainee nurse, I'm a trained nurse, I have to get 22,000 rupees, where the politicians will back up them, which actually I'm facing in my place in Kerala. That is actually not to be approved. You should actually, there is 2 problems in this country. There is no auditing or medical auditing is not there. Because there is a death happening in every hospital. Why the death happened? And who is responsible person? Whether a negligence from the doctor or from the system is not analyzed in this country, which is actually analyzed in the US. That is why we tell the American health system is under 100% the best system, which is not applicable here. A nursing care, a nurse going to US has to write an exam, and they have to just they have to really struggle hard to get a nursing admission in the US or a nurse entry in the US. Here it is, nurse is very easy. Just go to a building, pay 25,000. After 4 years, you get a nurse degree. Come to the hospital and treat. I think that is to be changed.
But they're also given more responsibility in the US.
No, it is responsibility not only as a nurse practitioner, nurse anesthetist, nurse coordinator, nurse pharmacist. They can do everything as a doctor.
Correct.
But that is only after analyzing, they are the best. One more thing actually I want to tell about the 24 and 48 hours. Will you see a movie for 24 to 48 hours continuously? 3 doctors sitting here. I think we never bothered about working 72 hours in the hospital. Exactly. Actually, I am a cardiologist. I think if you should enjoy the work. I don't think that is actually the molding of a doctor there. And you should understand that whether I should be penalized, I should be paid for that. I don't think that is the answer for that. No. A doctor should be molded for that. You are actually becoming a doctor, you are actually going to make a lot of money for that. That argument should be taken off. Actually, the doctor should have a service mentality. That should be the primary thing, and you make a lot of money and you are more paid than any professional in the country by the government. as a doctor.